In Africa, malaria is a life-threatening disease, causing over 600,000 deaths yearly. Malaria caused by Plasmodium falciparum parasites is the most deadly. Increased access to malaria prevention and treatment services is significantly reducing the malaria burden. The first symptoms of malaria are usually fever, headache, chills, and vomiting. If not treated within 24 hours, malaria can progress to severe illness, with multiple organ failure, often leading to death.
Malaria is one of the common cases we admit in the ward, and more often the children come in very, very sick when they have severe malaria. They come very sick, they are convulsing, they are in coma, they need oxygen, they need fluids.
The challenges are so many when you get a patient who is fitting with severe malaria. It's so depressing.
The main signs of severe malaria include coma, severe breathing difficulties, low blood sugar, convulsions, and severe anemia. Early diagnosis and early treatment can successfully cure patients. Artesunate injection is now the WHO recommended drug for severe malaria in adults and children in preference to quinine, based on the results of large-scale clinical trials. Countries across Africa are updating their guidelines to include artesunate injection as the first-line treatment for severe malaria. Injectable artesunate is the recommended treatment in preference to quinine for severe malaria. Artesunate injection can be safely used in pediatric patients weighing 6 kilograms and over, in pregnant women, breastfeeding mothers, and in all adults, including the elderly with severe malaria. The following demonstration is for 60 milligram artesunate for injection. Refer to your Malaria National Policy Guidelines if in doubt. Please ensure you are using a quality-assured drug. Artesunate for injection is prescribed at a dose of 3 milligrams per kilogram for children weighing less than 20 kilograms and 2.4 milligrams per kilogram for larger children and adults. It can be administered via intravenous IV injection or via intramuscular IM injection. The drug is packaged as follows. 1 vial containing a crystalline powder of artesunate, 1 small ampule of sodium bicarbonate for reconstitution, and 1 large ampule of normal saline solution for dilution.
The most specific thing when they are preparing the artesunate is to adhere to the specific steps of preparing the drug.
The preparation and administration of artesunate injection can be broken down into 7 simple steps. Step 1. Weigh the patient. It is essential to weigh the patient as the dose of artesunate is weight dependent. Step 2. Check the number of vials needed. The number of vials is based on patient weight. For example, the dose for a patient weighing 11.4 kilograms is equal to 11.4 kilograms multiplied by 3 milligrams, which equals 34.2 milligrams. So you will need just 1 60 milligram vial. An adult patient weighing 65 kilograms will require a dose of 156 milligrams. So you will need 3 vials of 60 milligrams artesunate. To prepare and administer artesunate injection, you will need a clean tray or kidney dish, swabs or cotton with a disinfectant, syringes, the correct number of vials, the sodium bicarbonate ampoules, the normal saline solution ampoules, and a pair of gloves. You must maintain an aseptic technique throughout preparation and administration of the artesunate injection. Step 3. Reconstitute artesunate powder with sodium bicarbonate. This step is necessary to activate the drug. Open the sodium bicarbonate ampoule with a swab. Draw up the full contents of the sodium bicarbonate ampoule. Inject the sodium bicarbonate into the vial. Move your needle back slightly so it is no longer touching the liquid and withdraw all the air from the vial. This is important to ensure adequate space in the vial to inject the saline solution. Shake gently until the powder is dissolved. Initially, the solution will be cloudy. The reconstituted solution will be clear within 1 to 2 minutes when left to settle. Discard if it does not clear, replace with a new vial and reconstitute again. Step 4. Dilute the reconstituted artesunate with the normal saline solution. The drug is usually prepackaged with the normal saline solution ampule. If it is not prepackaged, you can use the normal saline solution available in your hospital or health center, or use a 5% dextrose solution if normal saline solution is not available. Please note, water for injection is not appropriate for dilution. The volume for dilution depends on the route of administration. For the intravenous or IV route, which is the most effective route, you require 5 milliliters of normal saline solution. However, if you are giving the drug via IM or intramuscular route, the volume of normal saline solution required for dilution is less, only 2 milliliters. Thus, the IV solution has a lower concentration of 10 milligrams per milliliter than the IM solution with a concentration of 20 milligrams per milliliter. Next, draw up the required quantity of normal saline solution, depending on the route of administration. 5 milliliters for an IV dose or 2 milliliters for an IM dose. Inject the normal saline solution into the vial. Artesunate injection is now ready for use and must be administered within 1 hour of preparation. Step 5. Check the dose and calculate the milliliters you need to administer to the patient. You can refer to the dosing chart in your institution, or you could calculate as follows. As shown earlier, a child weighing 11.4 kilograms needs 34.2 milligrams of artesunate. To give it by the IV route, divide this by the IV concentration of 10 milligrams per milliliter, resulting in 3.4 milliliters. Round this up to the next whole number, that is 4 milliliters. Check your calculation twice. If you need to give the drug by the IM route, divide the 34.2 milligram dose by the IM concentration of 20 milligrams per milliliter, instead of the IV concentration of 10 milligrams per milliliter. The result is 1.7 milliliters and should be rounded up to 2 milliliters. For this adult patient weighing 65 kilograms, the dose is 156 milligrams of artesunate, divided by the IM concentration of 20 milligrams per milliliter. The result is 7.8 milliliters, rounded up to 8 milliliters. Step 6. Administer the artesunate. Let us start with the IV route. First, prepare a saline syringe to flush the line. Take a swab with a disinfectant solution and clean the IV port. Now, withdraw the required volume for IV administration. Check the patency of the line and then administer the dose. The rate for an artesunate IV bolus is 3 to 4 milliliters per minute. For example, for this pediatric patient, you administer the 3 milliliters dose over a 50 to 60 second period. Follow the IV bolus with an IV flush as per best practice.
Quinine, you have to give it slowly over 4 hours. But this one, if you are giving it IV, you just give a slow push.
Now let us move to the IM route. The vastus lateralis is the preferred site to administer artesunate. For young babies, spread doses of more than 2 milliliters over different sites, such as the deltoid or the gluteus, to avoid tissue damage. For larger children and adults, spread doses of more than 5 milliliters. Step 7. Plan the dosing schedule. Give the first dose of artesunate on admission and record this as time 0. Give the next dose at 12 hours after the initial dose and the third dose at 24 hours after the first dose. Prepare a fresh solution for each administration and discard any unused solution after use. After 3 parenteral doses in the first 24 hours, the patient should receive only 1 dose of artesunate a day for a maximum of 7 days or until oral medication can be given. As soon as the patient can take oral medication, give the patient a complete 3-day course of oral artemisinin combination therapy as recommended in the National Treatment Guidelines. Evaluate the patient's progress regularly throughout treatment with injectable artesunate, in particular the level of consciousness, anemia, and the ability of the patient to tolerate oral fluids.
You might feel anxious probably being a new drug in your facility, but the moment you get accustomed to it, it's a very easy drug to use.
Remember to always follow the 7-step process when preparing and administering artesunate injection. Step 1. Weigh the patient. Step 2. Check the number of vials needed. Step 3. Reconstitute artesunate powder with sodium bicarbonate. Step 4. Dilute the reconstituted artesunate with normal saline solution or 5% dextrose solution. Step 5. Check the dose to ensure that the volume drawn matches the milligrams calculated and the route of administration. Step 6. Administer. Step 7. Plan the dosing schedule. Injectable artesunate, prepared and administered correctly, saves lives.
I find artesunate very convenient to administer, quick and very, very fast. And I see a child who has come in very sick, and then we do our best, and the next morning or after some time they walk home with their mother, with their parents. That really makes us feel very good about the work we are doing, that we are doing a good job.